Viv needed a medium-sized filling. Instead of using anaesthetic, we thought it would be a good opportunity to try out hypnotic anaesthesia, using hypnosis to reduce pain. We had a couple of practice sessions in which we used disassociation and the idea of a pain dial to create numbness. We tested his reactions by attaching a bulldog clip to his hand, piercing his skin with needles and giving him ice cubes to chew. The day before his dental appointment, I asked Viv how he was feeling.
Yeah, I'm feeling pretty confident about it because, it's last time when we put the ice cube in, I could just let it melt against my cheek, and that was interesting. And you put a bulldog clip on my hand, and you had to take yours off, and really it could have stayed there for, I don't know, forever seemingly in that state. But when you took it off, there was, it looked like there was this sort of big white and red mark there. So that was interesting to be aware that there was this thing called pain, but it just didn't seem to matter very, very much. Was kind of nice.
That was your experience last time?
Yeah, it wasn't like there wasn't any pain. There was this thing that had a name called pain. It just didn't hurt.
Right.
That's a really good way to put it. Yeah, exactly. It was without meaning.
So, do you remember the things we did down in my house the other day? Did you your holiday there in Italy? Yeah, remember that? And you can go on a little holiday in your mind just to kind of have a rest. You have to ask that part of your mouth if it would be happy just while Alison takes care of it, looks after it, to just remain calm, cool and numb for you. Just like when you had that ice cube in there before. So I was just going to put some glasses on now, just like sunglasses running down the pool. You might be aware of some kind of sensations and that funny sensation of how you can have no sensation. And how nice it can be as the wind can blow sometimes there by the pool. And just like your hair drying there in the sunshine.
It's going to start being a bit more noisy.
It's all the noise. It's just like that aeroplane flying past in the distance. So that little child flying way off. You don't need to worry about that. Just something way off there. That way that you can be aware of those things up in the distance that you don't need to worry about. Just looking at those dials and making sure that you just notice what it is that you'd like to turn down and what it is you'd like to turn up, and amplify those good feelings and sensations there. Those tingly fingers down there. You just feel more and more comfortable.
That should be quite comfortable. Is it comfortable?
Yeah.
Good. Whiten your teeth and I'll do this.
You can just allow that numbness and comfort just to stay there for as long as would be right for you as well. Feels right there in the mouth. You can come back from your holidays. Just take a second or two to come back to the room. How you doing? You alright?
That was the easiest filling I've ever had. It really was.
Yeah? Less though compared to normal.
You
sometimes feel a bit
filling,
nervous.
I was a little bit nervous. I was nervous that there would be pain.
Yeah.
And there was like this tiniest little twinge.
Yeah.
But nothing like some of the things we were playing around with before to prepare.
Yeah. The worst bit was to come and see me.
Honestly, I don't know why people have anaesthetic for small things at all.
Yeah.
You feel a slight twinge, and I've noticed like I get a bit, you know, my heart rate would rise a little bit, but then I just go back to the ceiling and I'll turn a dial down and it would be gone.
Yeah.
And a couple of seconds later, the drill would be gone anyway.
Okay. And what was that like from your perspective?
Slightly strange from my perspective,
Yeah.
because I was constantly thinking, any moment now he's going to
He's going to freak out. Yeah.
It's a great way of doing it. You know, now I've done it once.
Yeah.
You wouldn't be
Yes,
scared
it'd be more
if you
normal
said, well, we need
next
to do
time,
something
yeah.
else.
Yeah.
Whether it would work for something a bit more intricate, you know, like a root canal.
How would you describe the filling? Was it small, medium? It wasn't a large filling, was it?
It wasn't huge,
No,
no,
no.
but it was well into denting. There was
Yes,
enough,
yes, you would normally use an
you would feel
anaesthetic
that,
for that, yes,
without a shadow of a doubt.
Yeah.
You'd feel that.
Time-wise, I can't remember.
Time-wise,
We started
it's about average.
about the same, about what you'd expect.
It was, you know, we're not looking at the clock thinking, oh, come on,
Yeah.
you know, it was probably about the same.